Today, we're going to demystify a medical tool you've probably seen 100 times in movies and TV shows, but maybe don't fully get. The urinary catheter. Believe me, it is so much more than just a prop. It's a really fundamental piece of patient care, and we're going to break it all down.
You know the scene, right? In any medical drama, it's often the first sign a character is in some serious trouble. But what's actually going on? What makes this seemingly simple little tube so incredibly important in medicine? Well, let's find out.
So let's just dive right in. In the next few minutes, we're going to cover all the essentials: what a catheter is, the critical reasons why one is used, the different types you'll see, and of course, how healthcare professionals manage them safely.
All right, let's start at square one. What exactly is a urinary catheter, and how does it actually work with our bodies?
Okay, so at its heart, urinary catheterization is a super controlled procedure. It involves a flexible, and this is key, a totally sterile tube that's gently inserted through the body's natural urinary passage, the urethra, and guided right into the bladder. Its main job? Just to drain urine when the body can't do it on its own. Simple as that.
And this is where basic anatomy tells a really important part of the story. You can see the male urethra is way longer, which can make the insertion just a bit more tricky. The female urethra, though, is much, much shorter. Now, you might think, oh, that makes it easier, and in some ways it does. But that shorter path is exactly why women have a higher risk of urinary tract infections from catheters. It's just a shorter trip for any potential bacteria to make.
So, now we know the what, let's talk about the why. A catheter isn't just something they do for everyone. It's a very specific solution for some very specific medical problems.
So when is it necessary? Well, it might be needed to relieve a really painful blockage, something called urinary retention. It's also absolutely vital during and after certain surgeries to keep the bladder nice and empty. In the ICU, it's an amazing diagnostic tool. It lets doctors measure urine output down to the milliliter, which tells them a ton about kidney health. It can also be used to get a perfectly clean urine sample or even just to help with hygiene for a patient who can't get out of bed.
But listen, there is one absolute critical red line. A catheter is never used if there's even a hint of trauma to the urethra. We're talking blood at the opening or a major pelvic injury. Trying to insert one in those situations could cause some really severe, maybe even permanent damage. It's a total non-negotiable safety rule.
Now, just like there are different reasons to use a catheter, there are also different types of catheters. This is not a one-size-fits-all kind of deal. Clinicians get to choose from 4 main types, and each one is designed for a very specific job.
Let's run through them. Think of the intermittent one as a quick release valve. It goes in, it drains the bladder, and it comes right back out. Then you've got the indwelling catheter, or Foley, which is the one you probably see most in hospitals. It's designed for a longer stay, held in place by this tiny little inflatable balloon. The suprapubic catheter is a pretty clever workaround. It completely bypasses the urethra and goes right into the bladder through the abdomen. Perfect for those trauma cases we just talked about. And finally, the condom catheter is, well, pretty much what it sounds like. A totally non-invasive external option for men.
And that brings us to a golden rule of patient care. Catheter sizes are measured on something called the French scale. And all you need to know is the higher the number, the wider the tube. The rule is simple. Always use the smallest size you can to get the job done. This isn't just about comfort. It's about protecting the really delicate tissues of the urethra from any unnecessary damage.
Okay, so we've covered the what, the why, and the different types. But how does it actually get put in place? Let's walk through the insertion process, which is way more controlled and careful than you might imagine.
You know, this whole procedure is really grounded in respect and safety. It all starts with explaining everything to the patient and making sure they have privacy. The absolute key here is what we call aseptic or sterile technique. Everything is meticulously cleaned to prevent infection. The catheter is well lubricated, it's inserted very gently, and for a Foley, once you see urine flowing, that little balloon is inflated to hold it in place, and then it's connected to the drainage bag.
So what happens after the catheter is actually in? Well, managing it correctly is every bit as important as inserting it correctly.
Once that catheter is in, healthcare professionals basically become data analysts. They keep a close eye on the volume of urine, which for a typical adult is somewhere around 1.5 to 2 liters a day. A big drop or a big spike in that number isn't just a small detail. It can be an early warning sign for things like dehydration or even kidney problems.
And this leads us to the single biggest risk. By far, the most common complication is a catheter-associated urinary tract infection, or CAUTI. There's a reason this is a huge focus of patient safety in hospitals all over the world. So prevention is everything, and the steps are actually pretty straightforward. First, gravity is your best friend. You always keep the bag below the bladder to prevent any backflow. Daily hygiene is absolutely non-negotiable. The system needs to stay closed to keep germs out, and you have to make sure the tubing doesn't have any kinks. But you know, the most effective prevention of all? Taking the catheter out the second it's no longer medically needed.
Okay, we have gone through a lot of detail. So let's try to boil it all down with a really simple memory trick that covers all the basics of great catheter care.
Here it is. Just remember the word catheter. C is for closed system. It's the best way to block germs. A is for aseptic technique. Got to keep it sterile. T is for trauma, which must be avoided by using the right size. H is for hygiene, absolutely non-negotiable. E is for empty the bag regularly. T is for timely removal, the #1 way to prevent infection. E is for evaluate that urine output. And R is for record everything. If you can just remember the word itself, you've got the core principles right there.
So there you have it, the urinary catheter, all demystified. It's not just a plastic tube, right? It's a really critical tool where a deep understanding of everything, from anatomy to infection control, can make a massive difference in a patient's life. Hopefully, this gives you a new appreciation for the incredible detail that goes into even the most common-looking medical procedures.